significant factor in the process. Welcome. Okay.
I think there's a connection problem at Mukesh's end, and I would like to introduce our new guest, Dr. Deepali Garg Mathur. She's a eye specialist based out of Delhi. Good evening, ma'am. How are you doing?
Good evening, Ankit, and a very warm good evening to everyone on board. And thank you for having me on board today.
Thank you, we're honored to have you. Just to bring you up to speed, today we are on the topic of COVID-19, and rather for individual impressions of how we go about dealing with it, both before and what we can do to prevent it. That is boosting your immune system through either herbs or spices and various other measures, as well as what you can do once you have, if you contract the disease. And most importantly, what other underlying factors, such as diabetes or other underlying conditions, have kind of contributed to the increase in the death tolls, at least in India and or around the world. Doctor?
Well, as you know, India is the diabetic capital of the world. And diabetes and other comorbidities do contribute to having a higher mortality rate in patients with COVID-19, especially uncontrolled diabetes. And when we talk about complications related to the eye, of late we have found that sudden vascular occlusions have been seen in patients who are diabetic and who have contracted COVID-19, and they may be one of those bizarre presentations of COVID. So we don't expect it. I think we are evolving every day. Our knowledge related to COVID is evolving every day. We are seeing myriad presentations which we hadn't seen earlier. From an ophthalmologist point of view, definitely if we are addressing a patient who's diabetic or who's got any comorbidities, we would want them to be in check before the patient is being taken for any kind of elective surgery.
Okay. Sasha, you
I think, Bill, I think viewers would like to know more about Dr. Deepali. So I would like to know from Dr. Deepali, what do you do, where are you from, and how was the experience as an eye specialist, I mean, before and after COVID and during COVID as well? Can you please tell us about your plan?
Yeah, so Ankit, it's been a long journey for me. I would say a journey spanning around 20 years. And it's been with varied experiences. And definitely being an elective surgeon, most of our surgeries are elective, and most of our our dealings with the patients are elective, barring the few emergencies that we do have. It has been impacted very strongly with the COVID-19 pandemic. So there was a time in the beginning, which I would call the first phase, where we were totally inactive, where branches like ophthalmology, ENT, and dentists had taken a total backseat because we have a lot of proximity between the patient and the provider, keeping us in the high-risk zone. But as the lockdown opened and people who had been waiting for long, were waiting for their elective surgeries to be taken in, now it's still a thing which is risky for both the patient as well as the provider. But we have realized how to keep things in place, what all to be done prior to taking the patient in the OPD or in surgery. And I think we are getting more intelligent by the day how to deal with this pandemic.
Okay, well, Doctor, if I can just ask a follow-up question.
Yes.
Over the past few days, there have been alarming numbers of reported cases coming out of India. However, yes, I believe that one of the reports said that certain government officials believe that some of these tests these positive tests are the result of inadequate testing. That is, that the test itself may have got it wrong, and that they've ordered retesting of some of the people. What can you tell us about that?
So I do agree that we did have inadequate testing to start with. But along with that, we also have what is called the validity of testing. So if we are dealing with an RT-PCR, we know that our validity of testing is much higher versus a rapid antigen test. So most of the people were accessible to a rapid antigen test, and we were having a lot of false results. We were having a lot of patients because they were being tested a little. So as you all, the test on the amount of viral load that we are addressing. So that is another thing which could have confounded our results. And now that we are seeing what we are penning down as a second wave, could be due to definitely inadequate testing, could be due to increased testing now that we are also addressing these with testing like the rapid, the RT-PCR. We are going in for more evolved testing. So we are able to address those patients who were first declared as being COVID negative.
Right, because it began to suggest a pattern over the last few days that at that rate coming out of India, 95,000, 96,000 each day, that was a startling spread. And I wonder, there's been a report that the United Kingdom or Britain is coming up with a plan to test people daily, and they're talking about millions of tests each day. Is India putting together a program like that to deal with these testing issues in the various states?
Well, as I said, that we are, evolving every day. So I'm sure even the government policy is changing every day. Yesterday has been a shocker, seeing 95,000 cases arise out of the blue. In fact, these last few days, as you correctly said, has been a wake-up call for all of us. So, but the thing is that being, away from normalcy for so many months has also not been right. It has also not hit the general population well. So it's a question of finding normalcy between this pandemic. So I'm sure they would be coming with a revised program, but in the meantime, they also have to be able to, address the economy, to be able to address people in all, in all ways, just not the pandemic, but the population in totality. So that is also very important.
Okay, Jay, I believe you have some questions.
Yes, thank you. So I was just curious because I love this discussion and thank you so much for the information. I was curious about how accessible PPEs and masks are in Indian cities, especially with regard to pollution anyway, that might be there and COVID-19.
See, I won't be able to give you an overview, but talking about Delhi and sitting in a premium hospital in Delhi, I'm in the Max Super Speciality Hospital, which is also a COVID center. So for us, the PPEs and the N95 masks haven't been an issue. Along with this, I also work with a charitable hospital called the Lions Group, and even there, they have been sure that we have been able to provide N95 masks to the patients, the caregivers, whatever staff that we have. As we are going ahead in this pandemic, we all realize that it is mainly aerosol generated, and so protecting your nose and mouth is very, very essential. So definitely, when we talk about ophthalmology as a brand, our surgeries are dealing with the patient, though they are close proximity, they're also short-lived. Our general surgery would take around 20 minutes to half an hour at max. And if we talk about patient dealing, we have implemented breath shields in close proximity so that the patient's breath doesn't impact you. Along with that, procedures which are causing aerosol generation. You'd be interested to know that even the eye is a source. The eye secretions are a source of COVID-19, and they can be the source of transmission. So it's very important for us to avoid hand touch to the eye at all given points. And few things which have been incorporated by world all over is having less, having less use of contact lenses, people switching over to glasses, which also acts like a protective shield, between you and the eye. And any kind of testing that we are doing, which is causing aerosol generation, we're going to avoid that, like a non-contact intraocular pressure test.
Okay, I'm curious, Sasha.
Yes.
Yes, as we go down this road, and all of that is helpful, what do you think of the idea of governmental mass testing? And do you think that that's even possible? Because obviously there were, as we've heard, there are issues with the kind and the quality of the test, but to do it on a massive scale, what are your thoughts on that?
no government efforts would be effective if there is a ignorant, stubborn population with certain doctrines, beliefs, and sheer stupidity is so obvious. So I think that yesterday I saw actually very interesting things on television. I think it was CNN. They showed interview with one doctor who helps the COVID-19 patients. So he's got one patient who tested positive, and he asked him, where do you think you got that? Where were you been the last few days? Whom you contacted, or so on? And he described that he was on one of the political rallies when there was no social distancing, no mask wearing. And he says that I don't care really what's happening. I trust in my leader, and I will die for him if it's needed. So I don't care about coronavirus. So next thing, what this doctor did, he took him in the ward where there were people dying from COVID-19.
Wow.
And they showed it to him and says, that's where you are going to be in next couple of weeks. There was incredible transformation of that guy. He started to cry, please help me, save my life. I don't want to die. I don't care about my leader anymore. Please help. He was crying and so on.
Well,
it's the story.
Okay, no, and thank you for that. I want to go to Rakesh and then Sharif. So Rakesh?
Yeah, I think it is, it's so easy to take a position, and without understanding what it actually entails. So you take a position, a political position, and then when you see what you have to go through, then the realization hits home. I might want to just pipe in that India is doing almost, just from newspaper reports, I haven't been to India for a while, India is doing 1 million tests a day, more than 1 million tests a day.
Wow.
So, which is quite impressive. It's more, in America, they're doing only 750,000 tests a day. So that is something which is good for the people of India. I don't know, between RT-PCR and the other one, what is the breakdown in the 1 million tests, but I'm hoping, for the sake of my country of origin, that it's a good balance, and the more reliable tests are being carried out, or a greater majority of reliable tests being carried out. It's also tricky because this is such a new virus, and at one stage in my life, I was trying to be a doctor. I'm glad I didn't succeed.
That's so funny. Because there are a lot of people in professions these days that wish that, it's the old saying, if I knew then what I know now, would I still be here, kind of thing. But who knows? Sharif,
no, I'm just being facetious. The doctors are really, as somebody said, saints in this situation. I often said to other friends of mine, I'm glad if I did become a doctor, I would have been in jail for some kind of malpractice, because I'm not a very careless person.
Well then we're glad you're not, and we're glad you're with us, and we're honored to have you, as well as all of our other guests. Now, Sharif, what do you think the impact of a governmental program of mass testing would be?
Okay. I have some specific point of views. First thing first, like example, okay, if I think about Malaysia, I can give you a different opinion, as well as I'm from South Asian continent. So I have a different point of view as well regarding the government policy and government activities and other things. First thing first, just compare the economy, cultures, and political point of view. I think Singapore, Malaysia is not so far from India, Bangladesh, Pakistan, and this kind of country. I do not want to go for Europe, even in USA, because this is far. We have a lot of difference in between our cultures and many things. But I want to say in between Malaysia and India, Malaysia and example. Even Bangladesh and this kind of country, we have very cultural difference. But what's the problem? Yes, every country has a problem, and the much example testings and PPE distribution and other things. If you see that, why Malaysia are doing very well, why Singapore doing very well? This is because of their government. Government take initiative that I want to do something, and they feel that this is their duties and responsibilities, as well as they are professional. Every country has good professional. I'm sure that India has good professionals, Bangladesh has good professional, Pakistan has good professionals, and there are many honest and sincere people. If you give them duties, job, and responsibility, they will fulfill it very well. I want to say Malaysia and South Asian continent is not much more different. Different is political views. Different is politicians. Difference is political system. Difference is policy. Like example, I'm very sorry, even if I am from Bangladesh, like even I can understand India, but I do not want to directly attack anyone. But fact is that, like, we are very unlucky, like country like Bangladesh, India, Pakistan, our politicians is so much of corrupted. Our politicians are, I'm sorry to say, they are not committed towards their country, towards their peoples, towards their systems or anything. And this is the culture. Even fact is that those who are the politicians and whatever, they are highly educated group of people. They're getting their degrees from Cambridge. They're getting their degree from Harvard. So they know very well the cultures and the how to handle, how to implement policy educationally and practically. Even example in the Gandhi family, I saw in Cambridge University, even in Bangladesh, that our advisor and many more from Harvard University, they are even very good scholars. Issue is Mahathir Mohamad, example in Malaysia, he took the decision, I will make my nations a good nations. Yes, they have problem. I do not want to say it's 100% okay, but comparison, if I want to compare and other things, only because of the political approach, even intellectual capacity wise, I want to say Indian people are great. Indian professionals are great, but only because of the political difference, political philosophical difference, political approach difference, there are far difference, and we already it's open. Already it's an open secret that how actually COVID open the internal systems, economical situation, everything already open. Those who are highly corrupted, those who have system error, those who have are not responsible toward their government, they are highly affected and they are facing lot of problems.
Okay. So I would like to ask Dr. Deepali that, I mean, during the COVID time, what kind of precautions as a doctor you have been taken care of? Because doctors are always the front warriors, and you have to go back and, I mean, you have to stay with your family as well. So there are a lot of day-to-day issues which, I mean, people like us can't even imagine, basically. And secondly, what do you think about Ayurveda, and especially the Kada concept? Because 80% of the Indians are having the Kada every day, and then they are taking sure that they're having the immunity boosting going on. So what do you think about that?
All right. So, Ankit, I'm sure that, you know, we are the healthcare specialists. We divide it into two parts: the frontline warriors who are coming in contact with, who are dealing with the COVID patients, you know, as a first line basis. And then we have the rest of the healthcare professionals who are also at risk, but they are not dealing with COVID patients on a day-to-day basis. Now, if you have the healthcare professionals or frontline workers, they all have to wear the whole drill. Of course, the PPE is imperative. They are put on normally 8-hour duties, whereby these healthcare professionals are not accessible to their phones, they're not accessible to food, water. They are on a strict duty. And sometimes we do, even if we feel that there is a risk or there has been a kind of contact, or the healthcare professional may have come across a COVID positive patient without realizing that the patient was COVID positive and is a contact. In that case, those patients are, those professionals are also isolated. So this isolation is also taken care of by the government. They have provided institutions, they provided staying facilities to the healthcare professionals. I think they've done a good job. And when we talk about the professionals who are not coming in contact with the COVID patients directly, but of course, since COVID is there to stay as per the present moment. So we all also, whether we are dealing with the patients, general patients in the OPD, or we are dealing with them as surgical candidates, we all also are properly attired. We are very sure that the patient is definitely wearing an N95, you're wearing an N95, or there's a suitable social distancing. The travel history of the patient is always accessed. We are also very sure that the patient is not running a fever, not carrying a cold and cough when he's entering the hospital, because he's putting others at risk. And yes, immunity boosting has always been there as a part of, and Ayurveda has always been with the Indians from time immemorial, and they all rely on it. So now to talk about your immunity, I have realized over this time that, you know, each person is reacting to COVID in a very individual manner. Though we have confounding factors like those who have, you know, pre-existing diseases like asthma or COPD or chronic obstructive pulmonary disorders or diabetes, or senior citizens, they're high-risk patients. But sometimes arbitrarily, you'll have younger patients also succumbing to COVID. So I feel that how a person is reacting to COVID is very individual. Also, it could also be dependent on the strain that you're getting affected with. As you know, that these strains are mutating every day.
Yeah.
So we can't say that COVID-19 is one particular strain. That is why our vaccines also are a little far-fetched. So we don't know whether we can really rely on our vaccines. These alternative therapies act well in conjunction with other things. Like supposing you are proven COVID positive, you can't only rely on alternative therapies. But yes, for prevention, to some degree, taking hot fluids, doing your routine gargling and doing your steaming, all these also help, along with taking Ayurvedic kara. Well, one for the road, even I think I'm also taking it. So I guess somewhere there is a belief that it does affect in making you stronger to fight the virus.
Okay. I think Dr. Deepali, we all Indians realize that turmeric, basil, and all those Ayurvedic, whatever we have as herbs in our Indian society, they are very powerful, and we should use it as a lifestyle rather than just using it during the COVID time.
Correct.
Absolutely.
Yeah. Just to add on to Dr. Deepali's and to Ankit, because all these herbs are also quite rich in antioxidant. And it's a proven, it's antioxidant, it is anti-inflammatory, it is antipyretic. So it's a combination of the things. So it is, yes, only dependent on Ayurvedic will not be help, but as a proper, along with the allopathic treatment, it is always, and it can be like lifestyle kind of like food supplement. So you can use as a food supplement, definitely chances of side effect is almost negligible. Anything excessive use is always has some negative thing, but if you are using as a lifestyle product, as a food supplement, there is nothing harm in that. And it's a quite rich experience, more than 5,000 years.
Yeah.
It's only thing is lacking, probably we need to have more clinical data to establish all these claims. So that is only thing is lacking. Otherwise, people are using it with years and years.
Okay, you know.
And Dr. Deepali, I would like to know about something that what kind of practices you are sharing with your patients who are going for the eye surgeons, like cataract and all this stuff. And also, there are a lot of patients who are suffering from diabetes, and they also have some problem with the eyes. So, what are the causes, or what kind of symptoms they are facing during the COVID time? Dr. Deepali?
Wow. Yeah.
I think there is some connection issue. I don't know.
You know, that's fine. I think that raises another issue that, sure, Sharif?
Yes, actually, even Dr. Deepali and Ayurved doctors, I know that India has very good Ayurvedic system. Even I know about Hamdard, and this is very good. Anyway, beside that, I have a question because I lose my family members in COVID-19. My aunties died, not for COVID. She died for the irresponsible behaviors from the doctors. Okay, what the issues? Okay, in my country, in Bangladesh, they said that okay, if you have any problem or any things, you have to test COVID. Okay, very good. If COVID is positive, then you have to go another hospital. If COVID is negative, then you have to go another hospital. But suddenly my auntie, she has a problem that she has a diabetic related problem, and suddenly she has fever. So problem is that, like example, getting testings and everything, it takes around 4 to 5 days. We tried our by our level best, but it takes around 4 to 5 days finish our COVID test. But in between 4 to 5 days, we cannot arrange any treatment from my country. So I want to say, beside and she died, and we get the COVID test actually negative, like she is not actually was not actually COVID patient. So why she died? She died because of irresponsible behavior from the healthcare industry. They are too much of stupid. They do not know how to manage the hospital management, and how to behave, how to taking care of the patients. Even everybody is not a COVID patient. There are different patients. There are some like emergency patient can come, and they do not giving them proper treatment. So there is a policy related problem, hospitality management related problem. It's not only that doctor or healthcare related problems. There is another thing, that hospitality management, like example in COVID period, how you have to handle the other patients, how you have to handle the other emergency patients. It's this completely stupid behavior, completely nonsense behavior. I'm very sorry. I'm very sorry.
No.
I'm from Bangladesh, I think.
Yes, definitely. I'm talking about Bangladesh. Even example, I have many friends even from India. I do not want to go there. I hear something. I do not want to, because Ankit and they are more responsible. They can say about that. It's a completely nonsense behaviors. That example, even they are not COVID patients, how they give them treatment, how they handle the present situation, what they have to do. On the other hand, politicians uses lot of fake news, lot of fake information. It's actually, I want to say, it's a totally stupid attitudes are happening. So so we have to overcome. Even I think that intellectual peoples and the professional people, not only this COVID situation, beside that, how they handle their hospitals, how they handle the different patients, what will be the role. Even they are not, how they, example, if 4 or 5 days, example, only because of 4 or 5 days it takes the COVID-19 test, my auntie died. So not only my auntie, actually I lose few of my friend, family member, only because of this nonsense behavior, fully nonsense behavior. So I don't know. I think
Sarif, I just have to mention one thing, because we are doing the COVID discussion since 7th of March, and we have invited a lot of doctors around the world. The problem what doctor or what healthcare people are saying, they have their own version, is that because they are also very new with this pandemic and they don't know how to deal with it. They are also having a lot of issues in terms of resources and all those stuff. So they are not sure what are the best practices, and they are also learning and optimizing it. But I know that always, whenever we're talking about health, which we lose, there is always a big, it's a big thing for us. It's not, we should not have to take it lightly, but we have to come up with a solution which will help both parties to come on the same platform and work on the infrastructure. Because you can understand, if you talk about Dr. Deepali or any other doctor in India or around the world, they are going every day, 7 days, double shift, working during the COVID period.
I know.
We are at home talking about it, and they need help, which is not getting the right help from the people. So I think there might be some misunderstanding or something which happened at some point of time. But what I'm saying is that we can't talk about the healthcare system is wrong. We can say that there's some problem in between which happens.
No, definitely. I want to say healthcare system completely wrong. You know how many, how much of money and corruptions happening. Example, I want to say Bangladesh. Okay, I do not want to say about India. Okay, I just want to say, you know how much corruptions happening in Bangladesh only in the healthcare system, and the politician involved, and it's a proven. Previous healthcare ministers almost sack. Even in this COVID period, our prime minister has to sack different kind of hospital. They have to sack different kind of even businessmen, even their deputy generals, because of we have to recognize the problem. If we do not recognize problem, we always say no, government good. Then we cannot. The reality is that I have to telling you the truth, and only because of the corruptions and the system error. And I try to understand. Let's say I ask Singapore, I ask Malaysia, why you are too good? Because they have a, let's say they are doctors also doing MBA. Why they doing MBA? Because of for handling the hospitals and this kind of management, they have to know how to handle these things. So, and they are doing in that way. On the other hand, I just taking responsibility of Bangladesh, I can say that there are a country like this kind of country in this COVID period, they have to be much more responsible.
No, I completely understand, and I think the problem is that it's difficult to manage bigger population countries rather than small countries, and small countries have done tremendously better job as compared to the bigger countries or developed countries during this time. But I'll go to Rakesh and see what he needs to talk about.
I'd like to point out that this is the virus which is often gets its the people who are infected completely asymptomatic. So it's really hard to say that it's only corruption. I really don't know Bangladesh, and really Bangladesh, so I'll take your word on it. But the fact that there's something, a virus where patients can be completely asymptomatic makes it very, very hard for doctors, to even know where if you're looking at it from a military strategy, it's like having a hidden enemy. You don't know where this enemy is. It's like when you're facing a sniper as against when you're facing a regular battle trooper, So if you're facing a sniper, you just can't predict where they are. And so I would be wary about faulting the medical profession. There is incidentally a specific course on hospital management which is being taught at several universities, and so they do have protocols. That is why they have medical protocols. Normally, I worked in a hospital for some time, so I can tell you with a reasonable degree, I wouldn't say total expert level, but a reasonable degree of knowledge, that they do have protocols to handle situations. And in a case where there's a completely unknown virus like this, one cannot help but feel a little sympathetic for the medical profession. Though if it was my relative, I would feel as aggrieved as you are. I quite understand that.
Right. I have a question, just maybe on a pivot, and that is, are we at the stage where we need someone to kind of assert control to try to stabilize things? And, maybe fines. What would you think about enforcing fines and fining people to get everybody to move in the right direction, either with masks and their general behavior? Sasha?
Well, I think I'm a strong believer in punishment system. Whether it would be corporate punishment in England in the 19th century, whether it's a capital punishment like the French invented guillotine for that purposes, and it was very effective device, worked really well and has great capacity and not very expensive to produce. For some people, look, you see, I'm surprised actually Canada went as far as its fine system. And I know personally a couple of people, but it was a time in April, the fines were only $1,000. And I know a person who was fined $1,000, and another one was fined $1,000. He was driving a car, and so he was stopped by police for driving a car, and he had to explain where he's driving and where is he going and from where he's going. And so they immediately knew the address of his house and the address of his work. So he was driving in a place where he was not supposed to be. He would drive just to work and back from work. And therefore, he was fined $1,000 right on the spot. You see, Canadians are not really rebellious people. They take, if it wasn't known that everybody has to wear a mask, everybody wears mask. It's not debatable whether you should wear a mask or not, whether the government is corrupted and therefore you don't follow their orders or policies or something. In US, it's very different situation, as we know. The issue is very politicized, and that's actually very surprising because a present a leader in Canada, Prime Minister Trudeau, extremely unpopular. He has now a few very sorrowful processes where he is being accused of all kind of serious things. And I think if election would be held today, he would lose as a landslide. But he will do so in the near future. Whenever his election is called, he's going to lose it. Everybody knows it. Yet, the Canadians are following this policies like wearing the masks and so on. There is no rebellion. So it's not really politicized. Okay, you may disagree with Trudeau, you may hate Trudeau, but it's nothing to do with medical issue of wearing the masks. That's what I'm trying to say.
Okay.
And Bill, I think Mukesh needs to leave, so he will conclude and before he leaves for the day. Mukesh, over to you.
Yeah. So just to add on, Mr. Sarif is talking, it's not just about the politician and doctors. It is many things depend upon the infrastructures, right? All the developing countries, if you are just spending 1% or 2% of GDP, so unless until you don't have infrastructure, demand and supply issue is the basic thing. So that always there will be integrity issue would be there. Second thing, of course, COVID-19 is altogether new challenges for the world. So understanding about how to deal with medically, emotionally, because it's not just impacting the health. It is we are seeing the case of many mental cases, right? Mental health are now in awareness and as well as talk about is quite high. So it's altogether a new normals are happening. So we every day we are adapting to the new challenges and trying to come out better. So I think I would say most of the professionals, most of the governments are doing their best. And it's as for India is concerned, I think it's a mass scale screening is happening. That is one of the reason cases is also coming more and more. But the silver lining is there. The death rate is probably one of the least in the world. So I think India is doing in that way is quite good. So this is all about my view about the India, how they are dealing with the COVID. And I'm sure Dr. like Deepali and other things, quite experts are there, so they can continue with the wonderful discussion. And once again, Ankit, thank you very much for inviting me.
Thank you, sir.
Thank you.
We look forward to have you again on IVPP.
Yeah, sure. Thank you. Thank you. Bye-bye.
So let's go back to Dr. Deepali and what we were asking Dr. Deepali. Can you hear us now, ma'am?
Yeah. I just logged in again, and now your accessibility is much better.
Okay, wonderful. So what I was trying to understand and what our viewers would like to know that what kind of best practice and precautions or prevention you are sharing with your patients during the COVID period, and I mean, what are your feedbacks or suggestions for people who are suffering from cataract and diabetics in their eyes and all those stuff? So I mean, because of COVID, do you think that they will also get some kind of an issue or virus contamination during the period?
Well, Ankit, now, like I said, elective work and our branch being an elective branch has now stepped back into action. We had a long sabbatical, but now we realize we have to live in the new normal. So I'll divide my care into two parts. One is what we are doing for the general OPD patients, and one is what we are doing for the surgical patients. So if you're talking about the OPD patients, it starts with initial screening of the patient at the very entrance of the hospital, whereby we have listed whether the patient has had a travel history and we have checked the patient for any cough, cold, or fever. That part is ruled out. Now the patient steps in. The patient maintains a social distance. We make sure that we're having a limited number of patients at a particular time. In fact, we have pre-appointed patients so that there is no rush at a particular time. The patient is definitely wearing a mask. As the patient goes up to meet the physician, he first goes through the normal testing. During the normal testing, we have aborted procedures which are causing aerosol generation, like non-contact tonometry. As the patient walks in, we make sure that the attendant is seated outside and only the patient is with us until unless the patient is senior or a child. The patient keeps a suitable distance. We are ourselves clad in PPEs. We are clad with the proper mask. Between the patient and us, we have breath shields because a large amount of our examination is on what is called the slit lamp. So the slit lamp is a device which requires extreme proximity between the patient and the provider. So the breath shield prevents aerosol generation. Patients who are presenting with conjunctivitis or a pink eye or a red eye, now that can be one of the presentations of COVID. So we have to be extra careful if you're dealing with conjunctivitis patients. If the patient has already had a word with you and has described the symptoms, we try to do a video consult and refrain from seeing the patient in person. If the patient has walked in and has not consulted you on phone prior to the appointment, in that case, we prefer not to do the no-touch examination, whereby we have started the medication and treated the pink eye or the red eye or the acute conjunctivitis with appropriate drops, and ask the patient also to keep himself on guard with regard to having developing other symptoms which are COVID related. Now coming to surgical patients, see, as we know, cataract is one of the main causes of blindness, and so is diabetic retinopathy. So both of these cannot be left for long. And these patients, lot of patients have sat back upon poor vision for so many months. And now we are taking them up for surgery. We are doing elective surgeries, even in terms of cataract. We are even stepping in and doing Lasik surgeries, which are so-called cosmetic spectacle removal surgeries. But we have stepped in and we're doing all kinds of eye surgeries. In this, there are two things which are very important. One is doing an RT-PCR for the patient 48 hours prior, though it's not 100% surety that your patient is not a COVID carrier, but yes, you are in a better boat if you know that the patient is an RT-PCR negative patient. Along with that, we are taking precautions, like the patient is definitely wearing a mask when he is entering the OT. We are using what is called 5% povidone iodine, which is called betadine. It is used in the conjunctival prior to surgery. So when we are using this substance, it is known to have virucidal properties. So it acts as a big preventive measure. We try to prevent aerosol generation. We don't always wear goggles because our surgeries are very fine, and sometimes fogging of those glasses causes the surgery to be affected. So your surgical results can't be impaired with wearing protective eye gear sometimes, but a mask on the patient and you is a must, absolute must. Along with that, I'd also like to say something in response to what Mr. Sharif was saying. You see, we've been hit with a pandemic after 100 years. When diseases like tuberculosis, smallpox arose, it took us years to realize how to deal with these particular diseases, and certain things we are developing even as of today. So I won't really blame the healthcare professionals. They are doing their best. You really need to be in their shoes to realize what is happening. When 8 hours, you're not allowed to eat, you're not allowed to drink, you're not allowed to do anything but be in that PPE and be surrounded by all COVID positive patients. I think it's a Herculean task. And they really need to be applauded at every given moment. And so initially, I mean, I'm very sorry for your loss, but I think, the professionals are also realizing day to day how to deal with this pandemic. It's showing us new colors. So these new colors can only be assessed on a day-to-day basis. It takes time to understand any disease, and I'm sure they're doing their best.
Wonderful, I think. So I think, Kim, you have some questions for Dr. Deepali?
Oh, yes. I love your mini lecture and response. And I love the discussion between Sharif and you. With regards to hand washing in healthcare facilities here in hospitals in Northern California, it's been an issue. I know that elective surgeries are popular right now, and it's an excellent time to do it because the hospitals are not full. And I was hoping that they would take more healthcare precautions, such as washing their hands, but instead they continue to rely on gels and convenient non-soap products. What is it like in India and Delhi, where you are? And how can we make any improvements with regards to the infrastructure generally in India and the healthcare institutions who are on the front lines?
No, thanks, Kim, for the question. But here we definitely impress hand washing. Hand washing is imperative. You may use sanitizers or gels only if you are, in a tearing hurry and you're doing it just in between procedures. But hand washing is stressed on majorly. We can't see a patient without hand washing. We have facility for hand washing at every location. So hand washing is stressed upon a lot. As we all know, the difference between a sanitizer and any hand washing is that we are removing the germs and the grime. So the grime also carries the risk of carrying the virus along with the germs, so you have to remove both. Whereas with sanitizers, you're only causing a loss of the germs. We don't even know how virucidal they are. And now with the sheer volume of sanitizers and gels which are required, there definitely is some amount of tainting of the product. The product cannot be as fine as it is when you're producing this product in low volumes. So we are very particular about hand washing. It is definitely stressed.
That's excellent. And with regards to the infrastructure improvements, what are your thoughts with regards to this in India or in Delhi?
See, we definitely have designated buildings also now. Besides the hospitals, we had converted a lot of the hotels also into areas where you could be isolated if need be. We are stressing on home isolation for patients who are not symptomatic or who have little or minimum symptoms, but with the very clear guidelines that monitoring of the oxygen saturation is very important in these patients. And along with that, keeping a fever chart is very important. You have to be in touch with the physician. Even if you're not physically present in the hospital, it is very important to be in touch with the physician and to be able to address any exacerbation of symptoms if required. So I feel in this disease, if you are not having major symptoms, it's better to be in home isolation. And when I say home isolation, I mean that you are not isolated as regards your symptoms. You are keeping a track of them, but you are not, you're not draining hospital facilities, because so many times we are not really requiring, our condition is not meriting hospitalization, but we end up using a bed which could be used for a patient who needs it, who requires it more urgently. Definitely, we are not able to cater to the entire population, because seeing the rise of patients which has occurred, it's been a major rise over the last 3 days. So we are running on full capacity in all hospitals, and we are trying our best to still cater to whatever patients we can. But my message would be that if you are good with COVID, don't fear the term COVID. That doesn't have to be feared. It's your symptom which governs whether you require hospitalization and care or not. So you may be walking with COVID, you may be asymptomatic, you may be walking with COVID, you may just not be having any issues, you may be walking with COVID and you may require hospitalization. So that those things are have to be governed by the patient themselves, and patient education is extremely important. Patient education is extremely important. Keeping the patient aware that they have to monitor certain things when they have been detected as COVID positive is very important. So the more we are, we are vocal about what all needs to be done, what all medicines should be kept at hand, what all things should be available, the better would be the results, and the lesser drainage of healthcare facilities would be there.
Okay, Bill, do you have some question for Dr. Deepali?
Well, actually, I was just generally wondering. We've heard a 2 to 3 year issue with regard to vaccines. I was wondering what your thoughts on the development of vaccines are. Here in the United States, there's a great deal of skepticism about how fast the vaccines can be developed, 1, 2, whether they're effective short-term and need boosters, and then 3, what the potential side effects are. So there's really mass confusion over there. I was wondering what it looks like from in the medical field in India.
Well, I would agree with you that there is skepticism even in India. And even personally, I am very skeptical about vaccines for 2 reasons. One, that for any vaccine to be successful, you definitely need to put it through a lot of trials. Second, this is an evolving virus, so it is mutating. And when a virus is mutating, you prepare the vaccine with one strain in mind, and then you realize that the strain has changed. So we are not yet, we are like babies in the field. We don't know whether developing a vaccine against one strain is going to be efficacious against affecting the other strain. So as of now, I feel it's very gray, the area, how vaccines are going to really impact the recoveries. I feel the other drugs which have come up for antivirals as well as HCQ in certain cases, azithromycin, these drugs in combinations, and as you all know, some of us have even treated patients with low molecular weight heparin, considering that it causes a coagulative kind of disorder in the body. So patients have responded to that better, and I feel they will. The second wave which has come up now, I don't know what your experience has been, but what I feel is that though we have a larger number of patients, but the severity of symptoms has definitely gone down.
Okay,
and you're having faster and better recoveries.
Okay, can I just ask you this one question, because I'm just curious.
Yes.
In India, because right now my understanding is that there are at least two identified strains. One that came from Europe, and then one that emanates from China or the Asian areas.
Yes.
Is it India dealing with one or both of the strains currently?
I'm sure they are, because like I said that, we are, the presentations of COVID, you are now fitting in, we're not all fitting the bill. We all feel that, here we've segregated the comorbidities, we've segregated the senior citizens, we've segregated patients with pre-existing lung problems, and still we have suddenly this healthy 30-year-old who succumbs to COVID, who has been a fitness freak, who has had no has had no disease, no hospitalization prior. Now, how do you explain that? How do you explain the fact that the disease is behaving so differently in different individuals? Along with that, I also feel that it is the viral load that you're impacted with. Like, for example, they say that if you have been in contact with a patient who has just walked past you, your viral load is much lesser. You have been in association with a patient who is COVID positive and who you have been talking to for 15-20 minutes. You realize that the patient has given you a higher viral load. You are now an orofacial surgeon and you have done an oral surgery in a patient who's COVID positive. You've just been impacted with a very high viral load. So these viral loads also impact how you are, how you are manifesting the disease. So I don't know whether it's exactly the strain or it's related to the viral load that you're getting.
Wow.
I think Sharif, you have a question for ma'am?
Yes, no, this is not a question. Actually, first thing first, I want to respect those who are actually frontliner, even only because of I am not against the doctor or nurse or anything. Try to understand my opinion. I said that what they are doing, this is very good. But issue is that who is actually handling the policy? Who is actually handling even right the way? Now I'm just focusing on Bangladesh. I can discuss about other country, but I just want to focus on Bangladesh. Even in this COVID period, Bangladeshi Prime Minister has to sack his Deputy General Healthcare System. She has to sack many hospitals because of COVID-19 wrong test. He she need to take lot of initiative because of corruption. PPE purchasing, there are a lot of corruption. And one thing, I respect doctors, but I just politely I just want to add, in developing nations, healthcare system corruption, not only in COVID period. I can give you example from 5 years, 6 years before. Example, our politicians, they were ministers, and they do lot of corruption. They buying their house, they buying their property in New York. Lot of evidence, not lot of news I can share. So better if we recognize that we have problem, and I'm talking about Bangladesh. I'm not talking about India. I'm talking about Bangladesh, to the point. So this is the one of the things. When example, this kind of corruption happen, but I want to say Bangladesh is not one and only country. I can give even evidence, many country happening these things. But example, this, if we cannot stop this political corruption, even not only COVID period, it's not the issue that, okay, this is new for us, we do not know how to handle. But this corruption happening 5, 10, 20 years before. Even 6 years before, we have evidence that lot of corruption only happening only for infrastructure development, only for buying equipment, only for giving training to the doctors, many things. And you know also the right things. I also know the right things. But truth is that somehow in some point, we have to unveil the truth, and we have to say that what's going on, it's completely wrong. I respect what doctors are contributing, how actually nurses are contributing, how police are contributing. But definitely we have political corruption. We have to accept it, and we have to remove this political corruption from our system. That is my request. And this is my very polite request, and honest request, and very sincere request. I can give you 100 of evidence that we have political corruptions in our healthcare system, not in COVID period, before this COVID period.
May I just also support what Sharif is saying? Because in Northern California, I worked for Blue Shield of California, and the chief actuaries whom I know, one of whom implemented Obamacare in California, is very supportive of boosting America's healthcare infrastructure. And part of this is related to the corruption that Sharif is talking about with regards to activism and legislative change in the healthcare industrial complex, right? Because a lot of Americans don't have access to services that they need, health services. And so I'm very thankful that in India, this is not the case. And I would love to find out how we can address this.
Dr. Deepali?
So, well, you know, Ankit here or Kim here, I would, like I said here, that we are definitely dealing with a demand and supply situation. You see, we don't have facilities world over to match up with the way this galloping virus has taken over. So I think it's what I stressed on earlier, it's segregation. It's segregation of those patients who are requiring hospitalization vis-a-vis those who don't. So education the patients, it's like teaching the patient how to handle himself or herself in the given situation if you're not serious enough. That panic has to be removed. We have to address the panic. We have to address the panic. We have to educate the general public. This COVID is going to be there with us for some time. I seriously hope we are able to get over it, but it is there as far as the coming few months are concerned. So, and as days go, you know, our requirement for healthcare services is going to keep increasing. And how much can we keep inflating, you know, this situation? So I guess it is all about public education. It's about segregation, and it's about Also creating new facilities, which is not so easy, because if you're creating new facilities, you're trying to, just come up with few hospital beds, or maybe another 100, another 200 on a different platform. You also need the manpower to be, handling those hospital beds. It's just not physically placing 100 beds in one place. It's a huge infrastructure, which would not come up overnight. And I feel it's just about segregation. Non-serious, serious, and removing panic. It's very important.
Wonderful. So that's a good discussion with Dr. Deepali. And ma'am, I think you need to leave, as you said that.
Yes, yes, I do. I did have to. And thank you so much. Thank you for this wonderful platform and a very encouraging discussion. Thank you so much.
Thank you. Have a good day. We'll have to host you again sometime.
Thank you, Ankit.